Hi there, so this tutorial is for our Kapalabhati, otherwise known as skull shining or skull polishing breath. As well as at the end, we'll do a Vayu Kumbhaka, which is an external breath hold, so that practice doesn't have to be done together. So keeping in mind that this is a very energizing breath, you don't want to be doing it late at night or on a full belly. There's also a lot of contraindications. I'm going to make sure I go over them. You definitely want to do it with warm-up, so you'll be making sure your spine is nice and straight and taking those maybe 3-part breaths, so inhaling, filling belly, ribs, all the way up to the collarbones, reversing the direction. Like that a few times, maybe about 10 times if possible. Definitely contraindicated for pregnancy, nursing, recent abdominal or chest surgeries, any illnesses, respiratory sinus infections, pacemakers, uncontrolled high blood pressure, any ear infections, nosebleeds, if you have cold or flu, not good, acid reflux, abdominal cramping or discomfort in any way. If you're menstruating, they say not to do it. If you have A-fib or tachycardia, multiple sclerosis. Also precautions if you have epilepsy, glaucoma, vertigo, unstable emotions, including the anxiety, depression spectrum, PTSD. So just a word to the wise there. Now, if you do the breath a lot slower, it's less energizing. Okay, so we'll do about 3 rounds. The first one I'll do fairly slow. So if you don't want to be very juiced up, energized, then you want to control it to about, so maybe 1 each second. So the other thing is we want our shoulders to remain kind of stable. It's just the solar plexus area that goes in. So it's a passive inhale and a forceful exhale. So breathe in and then after about 20 or 30, pause and take 1 or 2 resting breaths, just noticing where you are. And I'll speed up the next round. Big breath in, relax. So we'll start the 3rd round, and at the end of the 3rd round, I'm going to exhale out all of the breath. Forcefully, I'm going to lift up in my pelvic floor and my belly button, constricting the bandhas or the locks, sealing them up, and I'm going to hold my breath out. I'm going to put my hands down on the ground and hold my breath out for as long as comfortable. Okay? So you can obviously hold longer than that. You can also engage the throat lock, which will hollow you out. That's the 3rd bandha. And then just breathing normally. I recommend pausing and just scanning the body, the mind. Oftentimes this is accompanied by a little bit of lightheadedness. And if you do too much of it or too fast, you can get a little jittery or anxiousness. So just using caution at the time of day, the energy level you want to. The external lock or bandha is not necessary. You can just do the breath practice alone. This breath practice is technically known as a Kriya, not really pranayama, but when we use it in a sequence, we do call it pranayama. It has a couple benefits. It's going to be obviously energizing. It's going to aid in digestion. It can tone the abdominals. It's going to cleanse mucus out of the sinuses as well. All right, so thank you for watching. This is Ashley Caputo with Unwind the Mind, Hypnosis and Wellness. Make it a great one.